Welcome friends, this is Dr. Jaitly. I'm your cardiologist on your favorite website, MuniMeterHealth.com, which is dedicated to educating you about your human heart and the cardiac awareness and the heart awareness. From across the globe, one end to the other, we are on two channels, mainly and through your social media apps. So thank you for associating with us. And of course, before I delve into the subject matter, I just want to say a couple of things. One, this is purely a teaching channel. Two, it is, if you're having an emergency, obviously go and see your nearest doctor or nearest hospital, call for an ambulance. And three, for my interns, residents, and fellows, I'd just like to advise that do not take this as a substitute to your syllabus. Stick to your syllabus first, but this is your supplemental information that we are trying to offer you through these short video formats. Okay? So now the subject of the matter, as we get into the matter of the subject now, which is beta blockers today. Okay, what are beta blockers? Beta blockers is a special class of drugs which has been around for almost 50 to 60 years. And it's celebrating its tremendous success in the story of the heart disease. Now, mainly it is used for coronary artery disease. It's also used in hypertension. It is used in a setting where somebody's had a stent, and then it's used in somebody who's had a bypass. We call it coronary artery bypass grafts or heart surgery. So these are the 3 or 4 very important indications where beta blockers are, as a class, they are being used. Now, the first one that came out was propranolol, just so that you know. That was the prototype, propranolol. And 1960s and 70s, when it came out, this was the only beta blocker that's available. Then came the metoprolol, which was a very cardioselective drug. It came to be known and became very popular with the cardiologists. It's still very popular. Atenolol was the next, which is a little more longer acting version, but then it also was cardioselective. And then came the carvedilol, which was a combination of an alpha blocker and a beta blocker, but it's a carvedilol. And it worked beautifully because primarily because it showed that there was a prolongation of longevity, because these patients lived longer by clinical trials, numerous scores of clinical trials that have been done across the globe, primarily from the United States and Europe, and then of course India and the Indian subcontinent, but primarily from the United States. Most of the studies have clearly showed that people live longer on beta blockers. 2, the incidence of myocardial infarction is reduced. And 3, the angina process and the coronary artery disease, etc., the manifestations is much lessened. And the incidence of stroke is lessened because the blood pressure is better controlled. And of course, the hypertension, as I said, the morbidity and mortality is also reduced. So in general, all these indications, and then of course the results are just wonderful in all these patients who are on beta blockers. So having defined that, let's understand where we were. So my favorite schematic comes on next, which I always draw. Here comes off the aorta. That's the major offshoot coming out of the heart. And the first branches coming off the aorta are your coronaries, and this is your left coronary, which divides into 2. As you know, one goes as a circumflex, the other comes out as an LAD. And these branches, obviously, they intermingle and supply predominantly the front and the apex of the heart, as well as the left side of the heart. The right coronary arises from the right coronary cusp, and this is your branching of the right coronaries, if you will, and they all go and supply the apex. So the heart supplies the oxygen to the body, as we know. So that's the oxygen being supplied to the body. But heart has its own supply, and that is through these coronaries. Okay. So having defined that now, we understand it better that the coronaries are supplying the heart and heart is supplying the body. Okay, we've gone that a few times, but I just want to make sure for the general masses they have that base available as well. So now further, let's understand what happens in the setting when somebody's having a heart attack or the angina, or somebody's has had a stent or a bypass. We know that at that point the cardiac efficiency goes down. In other words, your oxygen consumption goes up and your efficiency goes down. because obviously there are obstructions somewhere along the line in these coronaries, and these are called atherosclerotic plaques. So the coronary supply, the blood supply, is reduced, so the heart has to still function at the end of the day utilizing more oxygen. So it works harder by increasing the heart rate, so the heart rate is up, and then the blood pressure by more forcefully contracting, so therefore the force is also up. Now, if that is the scenario, it will require more oxygen, therefore the oxygen consumption is high, and therefore the efficiency is low. We don't want that. So how do we achieve that? We want to try and achieve the opposite. In other words, you want to have the oxygen consumption go down and the efficiency improve. It's like a car. I mean, you're using a car, and say on a weekly basis, you're filling up the tank with gas or petrol, and turns out that now the car is utilizing, for the same amount of work that you're going back and forth and utilizing the entire day to drive, or through the week, now every second or third day you require more fill-ups. Or you require to go back to the gas station and have that filled. So either something is going on with the fuel consumption, which is definitely increasing, and or if there is also an efficiency in the car that's declining. So those are the two ways by which one can explain why there is increased fuel consumption or cardiac efficiency, which is going down. Now, the way to explain that in the heart setting is the following. The oxygen consumption is high because the heart rate is up. Instead of normally being about 60 to 70, it's about 90, for instance, or 100, 110 even sometimes. Blood pressure, instead of being at 120 over 80, it may be very, very high. It may be, say, 170 over 90 or 100. So you're looking at more force of contraction, which is utilizing more oxygen, and more heartbeats per minute. So your heart rate is also increased. So basically, beta blockers, what they do is they do the opposite. They decrease the oxygen consumption and increase the efficiency. So this is where the beta blockers work. So the beta blockers will basically decrease the oxygen consumption and increase the efficiency in these patients. So it's a reversal of the problems that primarily are present in the patient, because in the patient of angina, patient of coronary artery disease, patient who's had high blood pressure which is uncontrolled, patient who's had say a myocardial infarction, MI, those patients, they have an oxygen consumption which is relatively high compared to the normal counterparts, and their efficiency is low. So you want to reverse that, and the only way you can reverse that is by giving beta blockers. So beta blockers are very, very well suited in this setting because they reduce the heart rate. They will reduce the heart rate and reduce the blood pressure also. So that is the mechanism of action of beta blockers. So hope you enjoyed this very, very short video about beta blockers. And of course, there are contraindications and side effects, which we will talk about in subsequent videos, because that's beyond the scope of one quick video. But the whole idea is wanting to show you exactly where it is being used and what is the mechanism of action, basically reducing the heart rate and the blood pressure, and the various prototype of drugs that are available right now that commonly the cardiologists and internists are prescribing. Okay, so now this way you can go back and discuss with your physicians, with your medical staff, and you'll be able to talk to your physicians much more thoroughly. And this is mainly for the patients or their families when they go back and discuss their clinical conditions. And for the interns, residents, and fellows, obviously you know exactly how the beta blockers are working and where they're working and how they're working, etc., and how to use in various indications that we just prescribed. Looking forward to meeting you again at a different subject and a different video on MuniMeterHealth.com, your favorite website dedicated to teaching you about the human heart and its illnesses. And obviously we are sometimes going in depth with cardiology, mainly for our medical fraternity. So long, this is Dr.